Hi, everyone. This is Dr. Weaver. As promised, I am going to create this PowerPoint presentation regarding the skin disorder topical drugs. Remember, I was trying to get to this in class, but of course, we have the quiz that we had to complete, and I didn't want to make you guys late leaving. And so, again, as promised, I'm going to go ahead and speak to you briefly about the drugs that we use for skin disorders. So let me go ahead and start sharing. Actually, I want to, yeah, I want to do it like that. Uh, Give me just a moment, just trying to start sharing so you can see my screen, and hopefully you can. I did just do a test. All right. All right, folks. All right. So again, of course, this is an introduction to clinical pharmacology, and chapter 52. The topic of discussion is disorder, tropical topical, excuse me. In other words, we're applying medications to the skin, which is the route of administration, if you will. And always make sure that when you are administering your medications, that you're always looking at what is the route, because there are medications that can be given IV, that can be given PO or by mouth, that can be given a topical, buccal, and sublingual, and so forth. So always look at your route of administration. So let's take a quick look at the objectives here. All right. So all right, let me kind of back up a bit. So typically, well, I have been hearing at least people asking this question about what do I study? Well, this is what you study here. If you can list the types of drugs used in the treatment of skin disorders, we are likely going to, or they should ask you questions on your tests about these types of drugs. You should know the topical drugs that I have been highlighting for you. Explain the general drug actions. You should be able to explain the drug actions for each medication, what we're using it for. You should know what are the adverse reactions to these drugs, and what would be contraindicated. Why wouldn't we give it? You should also know that there's certain drugs that we can give, but we just have to give it with caution. All right. And how the different drugs interact with others, we should know those interactions. All right. Does it cause increased bleeding? Does it cause the blood glucose levels to be decreased, and so forth and so on? And then I'm going to, because I'll have more time to do so. We can go through the number 3, 4, and 5 objective, a learning outcome, distinguish important pre-admission and ongoing assessment activities. The nurse should perform on clients receiving a drug used to treat skin disorders. So I'll go over all that. The listing, a list of proper or appropriate nursing diagnosis, along with ways to promote an optimal response to treatment, and important points to keep in mind when educating clients and families, of course, about skin disorders. So I'll go through those in order to show you how we apply the nursing process to drug administration. All right. Now, these are the different types of topical drugs that we will be discussing. Some of these medications, of course, are used for other disease processes, but for example, the anti-infectives and antiseptic and germicides, corticosteroids, they think that even the immunomodulators, they're drugs that can treat other disease processes. But since we are dealing with skin disorders, these are the appropriate drugs that we will be using. So your retinoids, and I'll skip the ones I just listed. Your topical immunomodulators. In other words, we're manipulating the immune system to work in our favor. That's what that basically means. Your anti-psoriatics, right? And so, we are dealing with drugs that work against psoriatic disease, very severe skin disorder. Enzymes and keratolytics, and these basically break down, they eat, they destroy bad tissue, if you will, abnormal tissue. And also local anesthetics is something else that we use. Right. Now, typically, the most visible issue clients experience are skin conditions because, not only can patients see it, depending on where these skin disorders are located, others, the public can also see these skin disorders, especially if it's in the face, areas that we cannot readily hide. The hands may be, now, some of the most common, excuse me, the most common skin disorders include your acne, your dermatitis, psoriasis, rosacea, and as well as hair loss. Now, these can be treated both topically, which, of course, again, is what we apply to the skin. Medications applied to the skin, but they can also be applied systemically. So, with systemic administration, you have to think about medications we take by mouth, IV, intramuscularly, sub-Q. Those deal with the systemic preparations, drug preparations. Now, previous units that we have covered in the textbook introduce you to drugs for systemic use. All right, of these conditions as well as others. But in this particular chapter, we are going to be particularly discussing topical preparations. Now, the drug classes are listed above that I just mentioned in their respective categories. Drugs are categorized according to class and not necessarily the ailment. So, for example, drugs used to treat acne may be in the retinoid category, or can be an antibiotic, can be an antiseptic, or anti-inflammatory, such as your corticosteroids. Right. So this format will help you identify some of the common side effects of topical drugs, no matter what the patient's condition is. All right. Let's see. So take a look at the retinoids. Let me go back for a minute. All right. So take a look at the retinoids. Um, these medications, because they are applied to our skin or the local areas of the skin, they're going to cause local irritation, such as erythema or redness. They can cause dryness of the skin. They can also cause stinging and burning sensations. Itching may occur as well, especially within that first 2 to 4 weeks of treatment. And so this is something that should be conveyed to patients education-wise so that they won't stop using the medications. Now, these reactions can become worse with the use of medicates, abrasive soaps, or also even cleansers. Now, local reactions lessen as we use the these topical medications over an extended period of time. So these local reactions will subside. Now, sensitivity to weather extremes, be that hot or cold, may also happen. So the skin might be a lot more sensitive to hot and cold weather. All right. So let's take a look at the actions of these retinoids, as well as what we use them for. Remember, that's part of your objectives. We have to know the actions. We have to know the uses. Why are we using it? All right. It's very important because if you're passing medications in a medical facility and or wherever you are, and you know that well, this drug is not typically used for ABC, then that should prompt you to pause and investigate before you go giving medications, if you will. So retinoids have become the first line treatment. And so this informs healthcare providers that when something is a first line treatment, then it is more preferable than other listed therapies. And so these particular drugs would be considered your first line treatment of your facial acne and many other skin disorders. Now, these drugs are used both systemically, all right, as well as topically. Now, issues of fetal defects make the oral products unsuitable for pregnant women. And so, if a woman is pregnant, we may not want to administer these medications systemically because of the effects it can have on the unborn fetus. And so, the topical medications specifically target the local area without going into the patient's system. And so that's really the goal, right? Now, retinoids, as far as actions, mechanism of actions concerned, are chemically related to your vitamin A, and it regulates epithelial cell growth, and so it helps the skin cells to grow. Right. And essentially, stimulation of new blood vessels in the skin helps to nourish or bring nutrients to the skin. And of course, nutrients that is brought to the skin by these new formed blood vessels will help the skin cells to grow. Um, Now, topically, these retinoids prevent dead skin cells from clogging our tissue pores or facial pores. All right, that's what these medications help to prevent. Now, these compounds of these particular drugs, the retinoids, as you can see here, are used systemically, topically to treat acne vulgaris, Kaposi sarcoma, which is a cancer that is seen in a lot of immunocompromised patients, in particular AIDS patients, is where we saw this particular type of skin cancer. They have the bluish black lesions all over the skin. It's awful. If y'all get a chance, take a look at it. It's awful. Also, we use this drug for wrinkling. People who are trying to maintain the fountain of youth. These drugs because they nourish the skin, and so maybe they look a little younger. All right. In terms of contraindications, obviously, any drug that causes hypersensitivity, um, well, or rather hypersensitivity to drugs or their prospective components, we want to stay away from. If the skin is damaged, we do not use retinoids. If a woman is pregnant, we do not use them. Um, and of course, clients should avoid sun or sun lamps while using the retinoid medications. Of course, this includes going to your sun tanning beds and whatnot, those who like to get tans. And there is no known drug interactions, which makes these medications fairly safe, right? Now, when we do talk about not using this drug, when the skin is damaged, we're talking about cuts, sunburn, and also eczema, because the skin is open. And when we talk about hypersensitivity reactions, you need to think about facial edema. And of course, if the facial area becomes swollen, the oxygen or the airway can be cut off, and that's a problem. And so we want to stop these medications immediately. All right. All right. Some of the topical anti-infective antibiotic drugs, we want to talk about their actions as well as their uses. All right. So let's talk about the topical antibiotic drugs. All right. Now, these drugs exert a direct local effect on specific microorganisms. These drugs work on they affect adversely affect specific microorganisms, and they may be either bactericidal, right? In other words, they're lethal to bacteria, but they also inhibit bacterial growth. And so think about the bacterial static. So it does both. All right. I did highlight bacitracin, an important drug to remember. This is also an antibacterial drug. And what this drug does is that it inhibits the cell wall synthesis. And so it causes the cell wall of the microorganism to not be soundly built, if you will, or made. Right. And when that happens, that the microorganism itself becomes vulnerable and they do not live. All right. But this is an example of the antibiotic that is used in the topical form, bacitracin. Some of you probably heard of that before. We apply it to scraped wounds and such as that. When we get hurt, cuts and what have you. Now, we use these drugs to treat primary and secondary skin infections. All right. We also use it to prevent infections in minor cuts, wounds, scrapes, and minor burns. We also use it to treat acne vulgaris. All right. The next anti-infective, and remember, when we say anti-infective, this word does not just belong to what is it, your antibiotics, but it also refers to your antifungal medications, your antiviral medications, because remember, bacteria, funguses, and viruses, they are all infections, right? And so these topical preparations or drugs are used against any of these microorganisms. But here, of course, we're specifically speaking about antifungal drugs, the actions of these drugs as well as the uses. Right now, topical antifungal actions they inhibit the growth of fungi. Right. So we refer to these as superficial mycotic or fungal infections that occur on the surface of or just even of the skin or just below the skin, as well as the nails. Right, so this can happen to both the nails as well as the skin. Now, your surface fungal infections include disorders like your athlete foot. This is referred to as tinea pedis. Your jock itch, and we learned this in class, your jock itch, your tinea cruris, your ringworms, which is your tinea corporis because it affects the skin, the body itself, and also your nail fungus. And these are your onychomycosis. All right. Now, in hot and humid climates, a generalized fungal infection called a tinea versicolor is very bothersome. Your antifungal drugs, they exert a local effect by inhibiting the growth of your fungi. Right. So these drugs prevent the growth, the multiplication, if you will, of the fungi organism. Now, some of the antifungal drugs, what are they used for? We use them to treat athlete foot, jock itch, as well as ringworm. We also use it rather to treat cutaneous candidiasis. Fungal candidiasis, remember, is a fungal infection as well. and also other superficial fungal infections of the skin. And so that's the key. It's more superficial as opposed to going deeply into the layers of the skin. Right. Now we're going to move to the antiviral, anti-infective drugs. More specifically, we're speaking to the actions as well as the uses. And so, a couple of the drugs that we will talk about is the acyclovir and the penciclovir. Um, these are topical forms of antiviral drugs that are used to treat oral herpes simplex virus. Remember, that's herpes simplex 1 sometimes. And these drugs are also used to inhibit viral activity. All right. So, whatever activity the virus has to carry out in order to live, these drugs are able to inhibit that activity, which will in turn destroy the virus. Now, during the initial episodes of a herpes outbreak, we refer to this as the prodrome phase. It is the initial episode or period of this skin disorder. So remember that prodrome phase because we typically like to ask you questions about that. All right. We apply these medications directly on the lesions itself because it does help to expedite the recovery. Another medication that is considered over the counter in antiviral medication yeah, well, is the docosanol, and this is a cream again that is sold over the counter, and it also expedites or speeds the healing process. Right, and take a look, of course, rather take a look at what the herpes virus looks like on the male penis here. All right, take a look at the adverse reactions. And again, think about the fact that this medication is being applied to the skin. All right, so you're going to experience these different adverse reactions. Um, Now, the good thing is the adverse reactions are typically mild. Occasionally, the client may experience a rash, itching, urticaria, which is what we call hives, dermatitis, irritation to the skin, as well as redness. And all of these may indicate, especially the urticaria, um, it may indicate an allergic reaction to the medication. Now, prolonged use of topical antibiotic preparations may also result in superficial superinfections, the overgrowth of bacteria, in other words, and also the overgrowth of fungal microorganisms that um, that that are not affected by the anti-infective treatments that is being administered. So, if someone develops this overgrowth of microorganisms, be that bacterial or fungal microorganisms, the anti-infective drugs that is being used to treat the patient that actually caused it will not treat these certain bacteria and, of course, microorganisms. So you have to treat it. Typically, they may um, kind of back off with some of the medications that they're given, hoping that the normal flora will become more stable and more controlled, if you will. All right. The contraindications, hypersensitivity, again, obviously, we always want to be cautious about that, and we do not want to give these medications if someone does have a hypersensitivity reaction, an allergic reaction, in other words. Topical antibiotics should be used cautiously in a pregnant or lactating woman. And it is considered, of course, as far as pregnancy, a category C. So we're kind of getting up there as far as the adverse effects on the female. Acyclovir and penciclovir. We use this drug more cautiously during pregnancy. It is a category B, as well as lactation. So it can still be given and that's the key. It still can be given, but with caution. Your antifungals, such as econazole, is used cautiously in pregnancy, and it is a category B. And again, no known interactions are known, and that's what makes them or can make them a little more safer, especially compared to systemic administration. All right. Now, as far as a practice consideration, in other words, what we see used in practice, sometimes they use this solution called gentane violet. It is a bluish violet dye with some antiseptic properties in it. It is sometimes used to mark surgical areas and frequently used in veterinarian practices as well. Now, some people feel it is a homeopathic alternative for topical treatments of yeast and fungal infections rather than a topical medication. All right. So, yeah, just like your alternative drugs, your herbals and things like that, people consider this an homeopathic alternative to treating these types of disorders. And as I think I told you guys a number of times, yeast infections are very difficult to manage. All right, and so now we are looking at your topical antiseptics and germicides, their actions as well as uses. Right. Now, an antiseptic is a drug it stops, it slows, and also prevents the growth of the microorganism. A germicide, of course, is a drug that kills, so the bacterial cytal type of medications that kills bacteria. As far as action or the mechanism of action or how the drug works, the exact mechanism of action of topical antiseptic and germicides is not very well understood. Right. And you have to keep that in mind. They don't understand everything, but it seems to work. Right. Now, these drugs affect a variety of microorganisms, which makes them very useful. Some of these drugs have a short duration of action. All right. The mechanism of action does not last very long, whereas others may have a much longer duration of action, which might be preferable. Now, the action of these drugs may depend on the strength used and the time the drug is in contact with the skin or the mucous membrane. So that length of time does matter. Um, all right. So the longer, sometimes the better or the more effective. As far as uses, the topical antiseptics and germicides are used to reduce the number of bacteria on the skin surfaces. It is used as a surgical scrub and preoperative skin cleanser. Just before they go into surgery, they wash up or they more or less um, scrub in, if you will. Also, for performing, we use them to perform hand hygiene before and after giving administering care to patients. It is used in the home as a cleanser. And also, it is used on minor cuts and abrasions in order to prevent infection, because the staphylococcus and the streptococcus can get into the wound. So these drugs can help prevent these wounds or abrasions from becoming infected. All right. Now, these are your adverse reactions, contraindications, precautions, and interactions of the topical antiseptics and germicides. The topical antiseptics and germicides provoke very few adverse reactions, which again is a good thing. Now, occasionally, someone may experience an allergic reaction to these drugs, and a skin rash or itching may occur. So that's fairly mild, all things considered. Now, if an allergic reaction does occur, then the drug it should be discontinued. And so this is something you want to stop and also report to the clinical team. All right. And obviously, again, anytime something is someone has a hypersensitivity reaction, we consider that a contraindication to use of that medication. All right. Now, these are the topical corticosteroids that we use for skin conditions, skin issues. Now, the topical corticosteroids, they're going to vary in their strength or potency. It really depends on the concentration or the amount of this drug that is being used. All right. We use corticosteroids in the form of lotion, creams, or even aerosol sprays, in which the drug is actually suspended, and the area to which the drug is also applied. We're talking about open or denuded skin or unbroken skin. Um, Also, thickness of the skin over the treated area as well. Right, that influences absorption. You know, the thickness of the skin. It does influence the absorption of the drug itself. Now, topical corticosteroids, they exert localized anti-inflammatory activity. So they reduce inflammation, right? Because inflammation can be very bothersome. When applied to the inflamed skin, they tend to reduce the itching and the redness and the swelling, all of which is considered inflammation. Now, these drugs are used in treating various disorders such as your psoriasis, your dermatitis, rashes, eczema, insect bites, as well as first and second degree burns to include your sunburns. One of the drugs called Crisaborole is a topical medication used in the treatment of eczema that is not steroidal based. All right, it is not a steroidal based or steroid type of medication. They actually refer to it as a phosphodiesterase 4 inhibitor. All right, now this is a particular this is a particular enzyme, this phosphodiesterase. It is an enzyme which regulates inflammation. It brings about inflammation, right? This enzyme, phosphodiesterase, is an enzyme, and it allows this inflammatory process to come about. And of course, when we don't want this inflammatory process to come about, we create a drug that inhibits this drug or this enzyme from carrying out inflammation. Right. So the way this drug works is this crisaborole. It blocks the production of that enzyme. And if I block the production of the enzyme, then I reduce the inflammation that is associated with the skin outbreak. But it doesn't mean it has steroidal properties or anything like that. You're just blocking the enzyme that brings about inflammation. All right. The good thing about these drugs is that they don't possess the risk of steroids, which has many adverse effects. They can do some great things, but I tell you, they typically have some pretty awful effects. All right. Again, the localized reactions. Just take a look at this. The burning, itching, irritation, redness, dryness of the skin. There's also allergic contact dermatitis, right? People may have reactions to the steroids, as well as secondary infection. And, you know, when we talk about secondary infection, we're talking about, for example, if we're dealing with the skin, sometimes the microorganisms on the skin can cause other infections and whatnot, right? Now, these reactions are more likely to occur if an occlusive dressing is used. All right. Remember that occlusive dressing is like a plastic dressing that they place over top of uh, the um, the area where the medication or the topical medication is being applied. And so when that topical um, um, material is applied, it tends to make the absorption a whole lot stronger, if you will, or even better. It improves the the absorption. All right. If you apply too much of this medication, it can go into more systemic absorption. And so it gets into the system. It no longer is not only local, um, causing a local effect, but systemically it causes an effect as well. Right. Now, this is less likely to happen if you are, applying the medication appropriately or adequately. Right. Just can't go over the top, basically. Now, some of the systemic reactions are important. So we talked about the local reactions, and so this is what the systemic reaction looks like. And so when it talks about the hypothalamic pituitary adrenal axis suppression, you have to think about what the adrenal glands do. The adrenal glands produces salt hormones. It produces the steroids, as well as the epinephrine, norepinephrine, and so forth. And so if these steroids are applied to the skin and it is absorbed too much, causing a systemic reaction, it is going to lead to a condition called Cushing syndrome. It's like giving a patient too much steroids. And you can look at this picture or this image on this slide. Look at all of the different problems. This is what I was telling you guys about that steroids can have some decent effects, like it can help reduce the inflammation in asthmatic patients. But look at the side effects of what it does. Thinning of the hair. Take a look at this. Thinning of the hair, a moon face, right? See how around the patient's face is easy bruising, thin skin, weight gain because they retain fluid, stretch marks, and high blood glucose levels because it increases steroids, enlarged heart due to high blood pressure, and so forth and so on. That's a lot. So this is what steroids do. So whenever you guys hear me refer to how awful steroids can be, I want you to think about this image here. All right. Um, Cushing syndrome is basically like it's like the adrenal glands is in a hyper function state. It's just producing a lot of those steroids and the salt hormone aldosterone, and can even affect your epinephrine, norepinephrine, and whatnot. If the steroid levels are increased, it means that your blood glucose levels are going to be increased, and so these patients have hyperglycemia as a result. They also have glycosuria, meaning glucose in the urine. When the blood glucose levels rise, that blood glucose spills over into the urine, and of course you have glycosuria. All right. We'll probably get in to more of these types of endocrine disorders later on. I'm sure. I believe. All right. So your topical corticosteroids, some of the contraindications, precautions, as well as interactions. Obviously, if there's a hypersensitivity issue, we do not give it. We also give it as, it's contraindicated rather as monotherapy for bacterial skin infections. In other words, the corticosteroids alone should not be used to treat a bacterial infection. You need an anti-infective for that, but you can use the corticosteroids as a combination therapy, right? Not alone, because it's not an anti-infective; it's an anti-inflammatory. And of course, the infection will remain if you don't treat it with an anti-infective. You also do not want to use this medications on the face, on the groin area, as well as the axilla area. These areas are highly vascular, and they can absorb the medication much faster. And also, we do not use it for ophthalmic use. So for the eyes, we do not put this medication in the eyes. All right. If we use it in the eyes, it can cause steroid-induced glaucoma as well as cataracts. So don't do that. Now, the topical corticosteroids are not used as, again, sole therapy, especially in widespread psoriasis. All right. Sometimes we have to, again, go with anti-infectives. Use cautiously in pregnant lactating women. And also, again, because it is topical, there's little or insignificant drug interactions with it, which is a good thing. Skip that one. All right. So the immunomodulators. Let's talk about this one. All right. Now, remember what I said in the beginning. The when we think about these words, immune system, and modulators, something that is changed or altered, right? So we have these drugs that can manipulate the immune system to make it effective for us. All right. And so in this particular case, as far as the mechanism of action, um, immunomodulators, they reduce inflammation. They do this by stopping the production of what we call cytokines. All right. And of course, you're going to say, well, what are cytokines? Now, cytokines, this is all part of the immune system. These are tiny proteins that are made in the cells of our bodies, especially the ones involved in the immune system. And they act like messengers that help control how our body reacts to infections and injuries and also inflammation, right? So think of them as signals that tell other cells. Remember, it acts like a messenger, right? So it tells other cells what to do, helping our body fight off sickness, and it promotes healing, um, in the end result, consequently. Now, additionally, the immunomodulators are not they're not systemically absorbed, nor do they act on the collagen in the skin. So therefore, they can be used in those delicate areas, such as the face as well as the neck, right? Because it doesn't affect the collagen in the skin. So you have a little more widespread use for this drug. Um, Now, the topical preparations are used to treat on a short-term basis your atopic eczema flare-ups. It is used to treat actinic keratosis or sun or aging spots. Also, is used to treat genital and perianal warts and some skin cancers. Right now, your localized reactions, again, same thing. It doesn't quite change, right? Itching of the skin, burning, redness, and what have you. Some individuals may experience flu-like symptoms. Some clients may also develop photosensitivity of the skin, and so they should stay out of direct sunlight, even when they are not really using this particular product. So you have to educate or advise them to stay out of the sun because of the effect of this medication on the skin. All right. All right. So when will use of this medication be contraindicated? When should we be more cautious? And what other drugs do it interact with in a negative way, of course? Now, because of the risk of greater immunosuppression, remember these drugs, these immunomodulators, we're trying to reduce inflammation, meaning we are suppressing the immune system, the immune response. All right. And so these patients, they become susceptible to infection. All right. So patients who are immunocompromised already, they shouldn't use these immuno or topical immunomodulators because again, they're already immunocompromised. And when you reduce the inflammation or the inflammatory system, then these patients can develop infections and what have you. Now, long-term use is contraindicated because of risk of a skin malignancy. Remember, you're reducing the or weakening the immune system, and so remember the immune system, as I said in class today, I think today, it these drugs, or rather the immune system, it destroys cancer cells. Well, but if I weaken the immune system, all right, in order to, the goal is to reduce inflammation, then it can allow some of those cancer cells to come on through, so to speak, right? Pregnant women and lactating and pregnant women should use it or should not use this, or they can actually use it, but of course with caution. All right. One of the medications, trocolimus or Prograf, this is a drug we use in transplant patients to suppress the immune system, should not be given or taken by patients who are allergic to the microlidi, which is the antibiotic that we talked about earlier, microlidi, microlide, whatever you want to call it, antibiotics such as your erythromycin, your clarithromycin, and your azithromycin. Anytime your patient is allergic to, when your patients are allergic to these types of antibiotics, we do not want to give program to them. Wonder if that's I don't know if that's topical, or I know we give it by mouth, the program, but I'm not sure if they have a topical form. At least I've never administered it like that. All right. Now, not although not the flora, the medication is called fluorosil. Take a look at it in my notes. I'll go ahead and highlight that one as well, so you can take a look at it. So your book talks about, although this particular drug is an anti-cancer drug, fluorouracil, it's not an immunomodulator, right? Um, but it is used to treat actinic keratosis topically. All right. So this agent causes redness, crusting of the skin. The cream should be handled when a nurse is handling the cream for application to the patient. Um, it should be handled like chemotherapy therapy drugs, and so it should be disposed of the same way that chemotherapy drugs are disposed of. And you should also be wearing gloves when applying this medication to the skin. We do not want children, pets, or pregnant women to handle these agents or touch the cream when on the skin. And so, again, we have to make sure that we are wearing the right protection and whatnot. Fluorouracil is what it seems to be called. It's just an anti-cancer agent that we use to treat actinic keratosis. Anyway, so all right. Uh, and of course, as you all can see, this is psoriasis. A very gross um, picture here. All right, so topical anti-psoriatic drugs are used to treat psoriasis, which is a chronic skin condition that is manifested by the bright red patches that are covered with the silvery scales or plaque. All right. And it does this by helping to remove the plaques associated with this disorder. Right. So this is the reason why the topical anti-psoriatic drugs are used. It is to remove the plaque associated with this condition. Right. So your topical anti-psoriatic is contraindicated in those who, again, hypersensitivity, those who are allergic to this drug. Your anthrolin and your calcipotriene should be used cautiously. These are the medications, the topical anti-psoriatic drugs. It should be used cautiously in the pregnant, lactating woman. And also the fluorouracil, which is again the anti-cancer agent, should be kept away from children and pets, like we mentioned earlier. I don't know why they got that there. Seems like that's there twice. Anyway, let's see. Now, the topical enzymes, what are the actions and uses? Right. Now, a topical enzyme is used to help remove necrotic, that bad tissue, right? A dead tissue from chronic dermal, dermal is the skin. Sometimes patients develop ulcers of that layer of the skin. And so when we want to remove the necrotic tissue, we use the topical enzyme. Enzyme is going to eat it up. Patients who have severely burned areas, we want to eat up the dead tissue so that new tissue can basically be more exposed because it heals better, right? The good tissue is going to heal, right? Not as long as the dead tissue is in that wound bed, right, on the wound itself, then they won't heal very well. So these enzymes, they do aid in the removal of dead soft tissue by hastening the reduction of proteins into simpler substances. And so it breaks down the skin protein, all right? The skin is made of proteins. And so with this dead tissue, which still has some protein kind of qualities in it, these enzymes breaks it down so that it can be easily removed. Right now, this process is also called proteolysis. Remember that lysis or a proteolytic. So the lysis and the lytic, think about destruction or the eating away of some substance. Right. Now, the components of certain types of wounds, especially your necrotic tissue, your purulent exudate or pus draining fluid, it helps uh, uh, to remove these parts of the wound. Right. Um, because of course again the pus and the necrotic tissue will prevent proper wound healing, and so we're trying to basically remove it. It's like removal of this debris as we apply or after we apply the topical enzyme to the wound itself, and that's what we're basically trying to do. uh, the necrotic tissue, the purulent drainage is considered debris, right? And proper application of this medication will help to remove or aid in the healing of that wound because it is removing um, the um, the purulent necrotic tissue. Now, examples of conditions that may respond to application of this medication include second and third degree burns, all right, because the tissue in burn wounds, they die, they become necrotic, and purulent drainage, seeps are present rather in the wound. We also use it to treat pressure ulcers. All right. Sometimes they become necrotic. And ulcers caused by peripheral vascular disease. When we think about peripheral vascular, like the extremities, right, upper lower extremities, and sometimes when patients have a decrease in blood flow in your peripheral vascular disease, it's because the something is there's a problem with the vasculature. Maybe there's plaque buildup or whatever it is. If a patient has a lack of blood flow to their extremities, they develop sores, ulcers, and whatnot, because you don't have that oxygenated blood and the nutrients and so forth that is getting to those areas. And so once they develop the ulcers, this drug will be useful in removing that necrotic tissue and all the other components of these wounds. Right. An example of a topical enzyme is collagenase. Whenever you see a word, a drug with the last few letters of NACE, think about enzyme. All right, I need to actually highlight that one for you guys as well. I think there was another one. I think I had to. All right, maybe not. All right. So basically, in simple terms, this basically means that certain enzymes help break down dead tissue in the body. And they do this by turning the complex proteins that is in dead skin tissue into simpler substances. It breaks it down, in other words. It's kind of like breaking a protein down to an amino acid, right? Because remember, the amino acids are the building blocks for proteins that leads to the making or synthesis of proteins. And so if we can break it down, which is what these enzymes do, then it just makes it easier to remove. Right. So this process just helps the body to clean up and heal faster because you want that viable tissue. As you can look at this wound here in this picture, you see more beefy red tissue. You see some necrotic tissue in there as well. And that's probably where they will apply some of this medication. And of course, hoping that you only apply the medication to the bad skin, the the skin that is already destroyed, not the good skin, like here. All right. Some of the adverse reactions: mild transient pain, they experience numbness, as well as dermatitis. Right. Now, there is low incidence of adverse reactions to collagenase, and so that might be the preferred drug to a topical application to use. Let me make sure I mark that for you all as well. Um, Right. Now, topical enzyme preparations that we just mentioned are contraindicated in those with hypersensitivity reactions to the drug, of course. Also in wounds that are in contact with major body cavities or where nerves are exposed. Sometimes, patients have these injuries where the nerves are exposed, um, and you don't want to uh, uh, apply these topical applications to those areas because they can be absorbed and they can destroy the nerves. And as far as major body cavities, they can reach certain internal organs, if you will. And so that would not be a good thing. We also do not use this drug in fungating neoplastic ulcers. And so when you have neoplastic or cancer type of ulcers, we do not want to use this drug, this topical drug. Let's see. Now, these drugs, of course, are category B and should be used with caution in the pregnant and lactating woman. Now, the enzymatic activity, that breaking down of the dead tissue, if you will, may be impaired by certain detergents and heavy metal ions. What are those ions? Like your mercury and silver. Sometimes they use, these ions in some of the antiseptic solutions. And so, if you use the enzymatic medications on the skin areas where people are using these antiseptics, it might not let the enzyme work very well. And so that's what they're saying. All right. Your book also talks about the optimal pH for collagenase is 6 to 8, and so this is basically when this medication will be effective when the pH is around that area. If there's a higher or lower pH conditions, it will decrease the enzyme's ability to eat away the bad skin, if you will. So pH has to be within 6 to 8. So that's more like on the acidic end and also the alkalinic end, but not too acidic and not too alkalinic, right? Remember we talked about acids and bases, and so in the environment, the wound environment, where the enzyme medication, the collagenase, if you will, is going to be applied. We just want the pH in that wound to be within that 6 to 8 in order for the drug to be effective, and hopefully that makes sense. Keratolytic. This is a drug that removes excess growth of the epidermis in certain skin disorders. And as you can see in this picture, this is an excess skin disorder. All right, this is the epidermis. It works on the epidermis, which is the top layer of the skin, such as a wart. This looks like a wart. And these drugs, they can remove, of course, warts and calluses, corns, seborrheic keratosis. And basically, this is a benign um, colored skin growths arising from the oil glands of the skin, seborrheic keratosis. Just it affects the oil gland. Now, examples of keratolytics include your salicylic acid. I need to highlight that one for you all. Your masopracol also is another one. Let me highlight that one as well. All right. Now, some strengths of salicylic acid are available as non-prescription products. In other words, you don't have to get a prescription for it, depending on the strength, in order to remove warts on the hands and feet. So sometimes people may want to self-treat, and so they can be ordered over the counter, if you will. It just depends on the strength of the medication. Right. These drugs are also well tolerated. Occasionally, these patients may feel these local symptoms along with scaling and flu-like syndrome. All right. The contraindications, again, hypersensitivity, that's always a given. We use, or rather, we don't want to use them for moles or birthmarks, warts with hair growing on them, warts on mucous membranes, or infected skin. This is when we do not want to use this medication, or for prolonged use. Um, um, those who have diabetes or some impaired circulation, like peripheral vascular disease, or even infants, these medications should not be used. But they are used cautiously in the pregnant, lactating woman. Right. Now, this salicylate acid may cause salicylate toxicity if it is used for a long time. So we have to be careful about how long this medication is being used. All right. Now, this is your topical local anesthetic. It just numbs things up, right? It temporarily inhibits conduction of impulses from sensory to nerve fibers. So, in other words, remember, we have these sensory nerves in all over our body, and it helps us to detect pain, temperatures, touch, these different sensory um, feelings that we get because of the way the nerves are um, the way the nerves work. And so what this drug does is it, because if, for example, if I touch someone's hand, then, for example, a sensory impulse is going to send that impulse to the spinal cord and then to the brain, and the brain is going to interpret what just happened, that someone was touched, or that maybe there was something cold or hot, whatever the sensory component is. And so this drug just basically stops that impulse. If I stop the impulse, then that impulse does not travel to the spinal cord and then interpreted by the brain. So essentially, the brain has nothing to interpret because we're impeding the impulse. All right. We use this medication to relieve itching and pain that is caused by your minor burns, and again, minor fungal infections, insect bites, rashes, sunburns, as well as plant poisoning. For example, like your poison ivy, not ivory, ivy. Almost said that earlier in class, ivory. Let's see. The adverse reactions are local here, local irritation, dermatitis, rash, burning, stinging, tenderness. So same old same. Your contraindications, again, for your characterolytic hypersensitivity, of course, it's contraindicated. But we use it cautiously in patients who are receiving. You don't need to really know about the anti-arrhythmic drugs. This is just a certain classification of an anti-arrhythmic drug that treats dysrhythmias, cardiac dysrhythmias, or abnormal heart rhythms. So those receiving class 1 anti-arrhythmic drug, such as your tokenide and your mexalatine, we want to use it cautiously with these patients. Toxic effects are additive and potentially synergistic. So remember, those are some of the terms that we learned early as far as that foundational pharmacology vocabulary. And so when it's additive, it makes it more powerful. The toxic effects can make it more powerful. And when we talk about synergistic, it's just making it work stronger than what it usually does by itself. All right. And so that can be a bad thing because we don't want an effect that is exaggerated, that is too powerful, right? That is not what we're looking for. All right. Let's see, what is this? All right, so now we have made it to the pre-admission assessment. So for the objective data, we want to make sure we obtain a description of the skin lesion. We want to take pictures of it to use as documentation so we can determine if it is getting better or worse. We also want to measure and document the areas of involvement, including the size of the wound, color, as well as appearance. So we give a good description. Vital signs are important. If there's the drainage, we want to do a wound culture so that we can obtain the right antibiotic. For retinoids, before we administer this medication, we want to do a pregnancy test to make sure the woman is not pregnant. All right. Retinoids result. So the result of pregnancy test within 2 weeks if one is a female. Let's see, what else? What else? All right. So that's the pre-admission. Remember, this is our baseline data that we're going to compare everything going forward to those ongoing assessments. This is your subjective data. We want to get information from the client's description of the infection, including the report of pain, burning and itching. Also when it started and how long the symptoms have been lasting. Allergic history is also good. Drug allergies, it may prevent us from giving the patient something that could cause some major issues. Remedies attempted before seeking care. What over-the-counter products did this patient seek before coming to your facility? All right. All right. As far as your ongoing assessment, inspect affected areas for changes and adverse reactions, especially to the drugs, the adverse reactions. We're looking for whether or not it's gotten better or worse. We do not apply the drug. Um, do not apply a drug if there are changes that are noted. All right, so at the time of each application, inspect the area for changes such as signs of improvement or worsening of the infection. And also, we are observing for adverse reactions such as redness or rash. And so, what we want to do is contact the primary care provider and do not apply the drug if these or other changes have been noted, or if the patient reports any kind of new problems, such as itching pain, soreness at the site. Um, the nurse might be responsible for checking the treatment sites 1 day or more after application of the medication, and again, should inform the primary healthcare provider for any signs of extreme redness or infection at the application site. All right, let me do something real quick here, kind of shorten this up a little. Um, let's see, Mary. All right. Yeah, so make sure you essentially hold off on the application of the medication if these changes occur. That's what I want to emphasize. And, inform the doctor, let them make a decision on what to do. These are the appropriate nursing diagnoses, and this is what I want you guys to really focus on for your exams, so that you know how we implement these different interventions. So we have altered skin integrity related to the inflammatory process. For example, increased sensitivity to the drug. Acute pain related to skin condition or increased sensitivity to drug therapy. Infection risk related to entry of pathogens into the affected areas, especially broken skin. Altered body image perception related to changes in skin and mucous membranes is another appropriate nursing diagnosis. Um, let's see. And of course, expected, this is your larger goal here. Expected outcomes depend on the reason for why we're using the medication, but may include optimal response to the therapy. We hope that the patient is responding well. Management of adverse drug reactions, and as we know, patients, they will develop or likely develop some reactions, and so we want to manage that so that they can continue to use the treatment. And also, the patient should be confident in understanding of the prescribed medication regimen, because if they're not confident, then they're likely not going to adhere to the therapy. All right, so now we're at the doing part of the nursing process. That's planning. All right, so this is the doing. This is actions that we're carrying out. This is how we promote optimal response to therapy, in other words. So, in an acute care setting, rehab, or long-term care setting, we apply the topical drugs, and we manage and apply the wound a device if used as directed by the primary care provider. Not something we do, we don't take it upon ourselves, in other words. We also want to teach the patient how to use the topical agents if the patient is going to be self-administering these medications when they are at home. And so that's all a part of that patient teaching, in other words. Um, all right. All right. And so as we continue with how to promote the optimal response to this treatment, now the topical anti-infectives, we inspect the area and cleanse the skin with soap and water, warm water, unless different methods are ordered before each application. We want the area to be clean before we apply the medications. Right. Now we apply the anti-infective medications, and the area is covered, or sometimes it might be left exposed. So it just depends on the physician's orders. Sometimes they may want the wound covered. Sometimes they want it to be exposed, and we always want to apply the medications. Um, Either a thin layer or it should be applied more liberally. Right. Now, your topical and antifungals, we want to inspect the area and ask the patient about discomfort and other sensations experienced after, for example, inserting these drugs vaginally. And of course, we want to monitor for improvement. Right. So we must note improvement or deterioration of lesions of the skin. Did it improve? Is it deteriorating? Is it getting worse? Of the mucous membranes, of the vaginal secretions in the patient's record, of course. It is important to evaluate and chart the client's response so that the team knows what is going on. Um, and we as nurses, we have the eyes and ears, and so they really depend on our appropriate and timely documentation. Now, promoting optimal response to therapy using the topical antiseptics and germicide medications. We use and instill and we apply these antiseptic germicides as directed, again, by the primary care provider or by the label on the product, whatever the instructions are. We must take caution or remove client's clothing because iodine can stain of the skin. Some of these medications contain iodine in it, and so we want to make sure we're taking precaution, especially with the clothing, because it comes out with difficulty if it comes out at all. Right. We always also do not want to keep the medications at the bedside because with confused patients, they may, use it the wrong way. In other words, or try to use it and cause harm to themselves. Let's see. And as I said, iodine permanently stains clothing and temporarily stains the skin as well. And so care should be taken to remove or protect the client's personal clothing when applying medications like iodine solution or tincture. Tincture is another iodine-based solution as well. Let me highlight that one for you all to take a look at. All right. Now, antiseptic or germicidal drugs kept at the bedside, they should be clearly labeled with the name of the drug, the strength of the drug, as well as, when applicable, the date of preparation of the solution. So this is really important information to provide. Let me highlight that one too. I don't know why I didn't highlight that. All right. Now, be sure to replace hard to read or soiled, stained labels as needed. If the labels are stained, if they're hard to read, we just need to discard it and get a new, medication container. And again, these solutions are not kept at the bedside. Uh, Patients may mistake the solution as water or some other beverage, and so now we got another problem. All right. Let's see. Uh, all right. All right. And so now we're dealing with the topical corticosteroids. We want to wash the area with warm water and soap before application. Make sure it's clean before application. And we also want to apply sparingly. We don't want to apply too much because it can turn into, um, of course, systemic. Um, it can affect the patient systemically, in other words. Look here. Um, and also apply while the skin is still moist. And so this will allow it to be absorbed a little better. There's something else I thought. Let's see, topical corticosteroids are usually ordered to be applied sparingly, not too much. The PCP may also order the area of application to be covered or left exposed to the air. So just keep that in mind as well. Some corticosteroids are applied with an occlusive dressing as well. That occlusive dressing prevents air from getting into to that area, and it helps the medication to be absorbed a whole lot better. Um, let's see. All right. Your topical enzymes, we again want to cleanse and prepare the area and apply the topical enzyme as directed. We may have to apply a wound suction device if ordered. You guys saw the wound suction device sometime this week. Also, as far as the topical anti-psoriatic medications, we have to carefully apply this product to only the specific lesion and inspect the areas of application. So we only want to only want to apply this topical medication to the lesions on the skin itself, and not on the good skin. And of course, we want to inspect that area. The status of that the area affected area. We also want to report if there are any excessive signs of irritation to the clinical team. May have to discontinue the medication. Let's see what else. What else? All right. Yeah. So make sure you guys are bringing that to the attention of the physician. Um, As far as the topical anesthetics, apply anesthetics as directed by the primary care provider, which makes sense. Cleanse and dry the area. Now, in this case, now we cleanse and dry the area before the first application. Remember, some of the medications you leave kind of moist, but here you want it to be clean and dry. Remove all previous residue. If there's any residue that is left from the previous application, we want to remove all that. We also want to instruct the patient not to eat food for 1 hour after use of this medication. All right. Now, when a topical gel such as lidocaine viscous is used for oral anesthesia, in other words, sometimes patients may have we may give uh, viscous lidocaine because there's pain. Patients have conditions where they have pain in the mouth. And so we want to make sure they do not eat something until at least an hour after use, because the food can interfere with the drug itself, the oral application of the drug. And not only that, but most importantly, this viscous lidocaine, it tends to numb the throat, and so it does impair swallowing. And so we want to wait that hour or more for the swallowing ability to come back. Right? You don't want the patient to aspirate, in other words. Right? So that's mainly what it's about. The swallowing can be impaired with an anesthetic. All right. Let's see. Skipping that. All right. So um, different nursing diagnosis that we discussed earlier, monitoring and managing patient client needs. Remember, these are the client problems that are appropriate for these medications. Alter skin integrity, advise the patient to keep nails short, because if the nails are long and they're scratching, they're going to break the skin, or especially if they have a tendency of wanting to scratch. Use warm water with mild soap, not the harsh soaps, for cleaning of the skin. Rinse and dry skin thoroughly. As far as acute pain is concerned, use cool, wet compresses or bath to relieve itching, and also keep the environment cool. All right. Let's see. right? So most topical drugs cause few adverse reactions, and if they do occur, we may need to discontinue the medication um, to provide some relief. Dry skin increases the risk of skin breakdown from scratching. And so, again, this is why we want patients to keep the nails short so they don't break the skin. Um, let's see, just trying to look and see if I missed anything. Use cool, wet compresses for rashes or a bath to relieve the itching. Want to keep the environment cool, keep the client comfortable, right? In terms of infection risk, we want to observe the skin for signs of infection and report any signs of infection. In other words, like redness and heat, pus, elevated temperatures, and also elevated pulse rate may indicate an infection and possibly even a systemic infection. So we want to report this immediately to the primary care provider. Um, Dry, flaky skin is subject to skin breakdown and infection, and so we have to keep the skin more moist. We can use bath oils, creams, lotions to prevent the skin from becoming dry and flaky. So just keep some of those modalities or treatments in mind. Let's see. What else? What else? So remember your signs and what is considered signs and symptoms of infection. That's really important to keep in mind. We tend to ask questions about these things. Uh, temp. Oh, let's see. So your redness, heat, pus, elevated temperatures, and so forth. These can be signs of infection, and so be ready to report. In terms of altered body image perception. So we want to allow the patient some time to verbalize their concerns and also ask questions concerning the therapy. This can help alleviate some of the anxiety and concerns. We want to develop that therapeutic nurse-client relationship. You guys will learn more about therapeutic relationships, that nurse-client therapeutic dialogue when you get into psych. They talk about therapeutic nurse client communication, if you will. But basically, you're being non judgmental and open and allowing the client to, to talk. All right. So it is important to develop a therapeutic nurse client relationship that conveys an attitude of caring and fosters a sense of trust. That's the key. Listen to the client's concerns and assist them in accepting the situation as temporary. Also, to encourage the client to verbalize any feelings or anxiety about the effect of this disorder on their body. We also want to explain the disorder and the treatment regimen in terms the client can understand, like the teach back method, and discuss the need at times for long-term treatment in order to eradicate or to get rid of the infection. We want to help the client as well as the family to understand that the therapy must be continued until the infection is under control and not before. In some cases, therapy may take weeks or months to heal, and so we need to make sure they understand this. And so I have this information provided for you as well. So take a look at that because we do like to test, nursing students on how we communicate with our patients. The general teaching points here, we want to teach the patient the proper preparation of skin before the use of the application of the medication. We want to teach them about proper application of the drug, whether or not to cover the skin with the application. Sometimes a physician wants it covered, sometimes they want it open. All right. We want to teach them about the adverse effects of the medications and when to notify the primary care provider. Right. And I provided a fairly good list of of what we should be looking for, what we should be teaching these patients. And so for example, I read this one. It talks about keeping the product away from the eyes unless use in or around the eye has been recommended or it is prescribed by the physician. Do not rub or put the fingers near the eyes unless the hands have been thoroughly washed, and all remnants of the drugs that is left on one's hand is removed from the fingers. And so we want to make sure the hands are thoroughly washed. If the product is accidentally spilled or sprayed or splashed in the eye, we want to wash the eye immediately with copious amounts of running water, and also contact the primary care provider um, immediately if burning, pain, redness, discomfort, or blurred vision persists for more than a few minutes. I know at Terrace, there is a room over on the TCU side. I think it says eye wash or eye irrigation. Sometimes they have these devices that almost look like eyes, but it's the way it's configured. When you go and you turn the water on, and it just flushes the eye out or dilutes the chemicals in the eyes. And so those are questions we like to ask our students about as well. So just kind of keep that in mind. It's just an eye irrigation kind of a system. I'll show it to you, my people. If I didn't go inside, but it's what I'm thinking it is, um, or how it's constructed, if you will. All right. So read the rest of this information. It's on slide 49. Hopefully, it's more common sense ish. When you look at it. All right. And 50. So as far as um, client education, drug specific teaching points, the retinoid, noids. Female clients must have a negative pregnancy test within the last 2 weeks of starting the drug, and birth control is usually used if the patient is sexually active. And some of this we've already read. I don't know if I remember reading about the birth control, but it would make sense that if a patient is on these medications, they may need to use some kind of contraceptives, um, in order to not get pregnant while they're on this drug, because they shouldn't be on this drug at the same time and get pregnant. Your anti-infectives protect skin from ultraviolet rays if using gentamicin. This is really important to know. With your clindamycin, report severe diarrhea if it occurs, because we can be thinking about C. diff or some super infection. If the patient experiences stomach cramps or bloody stools, we need to make sure the physician is aware. Right. Now, this gentamicin may cause photosensitivity, and so we have to take measures to protect the skin from ultraviolet rays. So we wear protective clothing, or that should be taught. Sunscreen should also be employed. Let's see. Let me get rid of that. Right. All right. So remember what I said about the gentamicin. That's really going to be important. May it really end up on your test as well. And the topical clindamycin may be absorbed in sufficient amounts that even though it's topical, it may be absorbed systemically and can result in, for example, the severe diarrhea, stomach pains, or cramps, and so forth. So make sure you read that. Um, as far as the antifungals, we want to clean the area and apply the ointment or cream to the affected areas only. Do not decrease or increase application amount or times per day. We want to give it as prescribed. We don't want to change anything without consulting the physician. If being treated for a ringworm, The patient should use separate towels and clothes and cloths for bathing in order to prevent spreading the infection. And so, when they go, if they're being treated and they're at home, we want to make sure that family members are not using the same towels. And so, but keep in mind that does not always apply to all people in the sense that some people might not be able to afford to do that. So always keep that in mind when you're dealing with your patients. Those social determinants of health. Some people may not be able to afford the things that we normally would think would be or should be affordable. So we all at different places, of course, in our lives. The antivirals, we use the finger cot or glove to prevent auto inoculation. In other words, we have to use some protection. We want to protect ourselves so that we don't expose ourselves to these antivirals. Um, um, Especially to other sites when applying these ointments. Educate the client that this drug does not prevent infection to others. All right. So in other words, even though we are treating some viral infection, others can still be exposed to these patients and they can get sick. So we have to take precaution. This product will not prevent transmission of infection to others, in other words. So, standard precautions and maybe some other appropriate precaution. Transient itching, burning, rash may occur as well with these drugs. So, uh, a finger cuff is a medical supply used to cover one or more fingers when a full glove is unnecessary. So, Um, so y'all can probably imagine what that would look like. It kind of looks like torn gloves, but the finger parts are intact, but not the hand, palm, back of the hand portion. Um, so anyway, all right, we're almost at the end, folks. So your topical corticosteroids, apply ointments, creams, and gels sparingly in light film and rub gently. When we say sparingly in light film, we're not just packing it on the area. Do not use bandages, dressings, cosmetic, or other skin products over treated areas unless directed. All right, especially your cosmetic or skin products. You don't want to do that. Doesn't look like I did a lot with this. All right. Anyway, and as far as evaluation, we want to know if there has been a therapeutic drug response. Has it been achieved? We don't want to do an intervention and then not evaluate because we don't know if it worked or not. Adverse reactions are identified, of course. We report it to the primary care provider, and we manage successfully with appropriate nursing interventions, rather, if patients do have reactions. Because remember, we want to help them to manage the adverse reactions. Only way they'll continue to take the medications, right? We also want to make sure that the skin remains intact, that the patient is free of pain, no evidence of an infection is seen, or the infection is subsiding, or and whatnot. Perception of body change is also managed successfully. We just talked about that, how we that nurse client therapeutic relationship. And also that the family and clients that they express confidence and they demonstrate understanding of how to use and apply these medications and what to report and so forth. And folks, that is it. And I'm so happy. So happy that that is it. All right, so let me stop sharing over here so I can end this. Uh-oh. All right. All right. All right, folks, I'm going to stop sharing and I'll get this over to you all. Take a listen. Let me know if you have any additional questions, and I appreciate your time. Unfortunately, this did last for about an hour and 40 minutes, but you can. I'm going to put it on a YouTube platform, and so you can speed it up a little, not too much, because then you might not understand what I'm saying. All right, folks. I appreciate you. Thank you.